Well, Dr Jenny Vaughan is the Vice Chair of the Doctors Association UK, which advocates for British doctors and for the National Health Service. I spoke to her from London. Dr Jenny Vaughan, thank you so much for speaking with us at such a busy time for you. Brisbane has been put into lockdown for 3 days here in Australia after just one case of the UK strain was discovered. Do you feel that is a sensible response?
I absolutely do. I think we should have done lockdowns here much sooner. I believe that Australia locked down in March and you've had far less deaths. You've recorded about 1,000 deaths, and I know that's around mainly in Victoria province, and of course you have a less dense population and you have a much larger country. But even that all being said, we are now hitting the same number of deaths a day as we did in the first wave. That's 1,000 a day. But what's really concerning is that the number of people in beds in the United Kingdom has far surpassed that of the first wave, and we're in the middle of all our winter pressures. So I don't think you've overreacted there. I think we should have done that much sooner. Just today we heard that to fly you have to have, to enter the United Kingdom you have to have a negative COVID test, and I think that's the right thing, but why wasn't it done before? And I think Australia's done absolutely the right thing with having very strict quarantine for 14 days before people can then go into the country. This new transmissible strain, it's a horror. It's between 50 and 70% more transmissible. More of our healthcare staff are getting sick this time. We lost over 650 in the last wave. Everybody is very concerned. I do not think that's a disproportionate response.
Well, earlier this week you recorded more than 60,000 cases in 24 hours, which is terrifying. How much longer can your health system cope with this?
There's a real fear that within 2 weeks London will run out, 2 to 3 weeks, if not sooner, London will run out of beds. It's deeply worrying that this is what's happening, and everybody is terrified of that, so they are actually looking at all the plans. We've stopped elective surgery, we've closed outpatients. We are using every available bed, and in fact my husband's hospital last night, it declared it was 173% put full. That's in Kent. And the reason for that is that how can you have 173% capacity, you might say? Well, you can have that if you're actually converting as many of your theatres into ITUs to ventilate patients, if you are looking after them like that in A&E, and there wasn't a single unoccupied bed in the hospital. So in that area, at least 10 hospitals have declared themselves running at full stretch. So it is a deeply concerning what's going on, but all and every plan is being made to sort it out. All doctors, all nurses are being mobilised, whatever their job, they're being deployed into roles, and everything's changed so that we can try and save as many lives as possible.
I can't imagine the strain on every single health worker on the front line at the moment. Is it the case also that this new strain, this highly transmissible strain, is affecting younger people more severely, people in their, say, 20s, 30s, who before now weren't considered at high risk?
I mean, that is the worry, indeed. Now, I speak for the doctors. I'm the Vice Chair of the Doctors Association, so we have lots of frontliners who are actually looking after these patients inside intensive care units. And what they tell me is that they're seeing younger and younger people, so people in their 20s and their 30s, 40s and 50s, who didn't have any preceding health conditions. In the first wave, it seemed to be more that they were older people with health conditions. Now, it's hitting more of a younger population. That's absolutely true.
I know you mentioned that you and your organisation were in favour of an early lockdown. Boris Johnson finally relented earlier this week, announcing a 6-week hard lockdown. Is it too little, far too late?
Well, it should have been done before, and actually we were the first medical organisation to call for an early lockdown representing actually frontline staff. But what we can't forget here is the effect of this on the population. So many people losing their jobs, having mental health problems, being locked in lockdown, kids not being able to go to school now. There's obviously a lot of problems when you do that, but you have to balance that against the fact that people are dying. This is a catastrophe. We have to get on top of this virus. But where we are now that is different is the fact that we do have a vaccine, and we've already vaccinated over 1 million people. But at the moment, the vaccine programme is going ahead with the intention of vaccinating most people as quickly as possible with the first dose here. And we hope that that will make a difference. But I think the timescales that Boris Johnson is working with, we probably won't realise. He said we'll be out of lockdown February half term, early March. It may well go on longer than that. And the longer it goes on, the harder it is for the nation to recover, for people to recover, for livelihoods to recover. But it's the only way to stop community transmission, to buy us time to get the vaccine and stop more lives being lost and stop the NHS being overwhelmed. It's already at the brink.
Oh, we are thinking of everyone on the front line of your COVID fight in the UK at the moment. It's an absolute nightmare where you are. Dr. Jenny Vaughan, we really appreciate your time and your insights. Thank you for joining us.